Hello, everyone, and welcome to Assure Learns, where today we are going to focus on workplace impairment intervention and how can we practically approach this. This is one of the things we get questions about. One of the most often things we get questions about is how do we appropriately deal with an employee who we believe who may have a problem with substance use, who may not. We're not entirely sure. Can we request a drug test? What's within our right to request? Do we have to be 100% sure? Should we do a drug test, drug and alcohol test? What are the signs that we should be looking for? So that's what we're going to focus on today is how to appropriately intervene when you believe that an employee or worker of yours may be under the influence of a substance and may be presenting as not fit for duty. So glad that you're here with us, whether you're with us live or watching the replay. Glad you're here with us. So here's where we're going to go today. Our agenda for this webinar is addressing, first thing, why addressing workplace impairment matters. So what's at stake? So we're going to think about who are the players involved. OHS, your company drug and alcohol policy, Canadian model for providing a safe workplace, and Canadian human rights. We're going to look at each of those stakeholders in this because it's about much more than just your company and your workplace. It's about there's so many other things at stake here. It's the environment, it's the public, it's contractor sites that you're working on. There's many different players in this. So we're gonna take a look at each of those and their stake in this. So number two is when do we intervene? Some things to consider. What does impairment look like? What does it sound like? What does it smell like? It doesn't look like the same thing on every person. So we're gonna give us some reminders around what substance impairment can look like. 5 steps of an intervention, which comes from our supervisor reasonable cause course, 5 steps of a reasonable cause intervention. Then we're going to look at after the policy violation, now what? So if somebody fails a drug test, tests positive on a drug and alcohol test, self-discloses a substance use disorder, now what? What do we do? How do we appropriately deal with this? So I'm going to give you some steps on that. And then the fifth is how to train your team to get everybody on the same page. So you're dealing with this as a unified team. And then, of course, if there's questions, I'll leave some time for that at the end. The best, though, is if you've got questions, just write them in the chat as we go. And then I'll watch for those and address those as we go. So questions, write them in the chat as soon as they come up. All right. So a bit more about me. I'm the founder and CEO of Assure Occupational Testing. We are in our 16th year of helping companies ensure their workplaces are fit for duty. The workers are fit for duty and workplaces are safe. And how we do that here at Assure is we do that largely through drug and alcohol testing, drug and alcohol policy development, fit for duty policy, support, occupational health testing. So all of the audio mask fit health assessments, physical abilities testing, and then training just like this, making sure that you and your team are equipped to understand OHS and your company policy and enforce them appropriately and uniformly across your company. So let's dive into today's topic. So why does this topic matter? Why does it matter? Why is it important that if you believe one of your workers is impaired by a substance or presenting as not fit for duty, and you're not even 100% sure why, you just know something's different about this employee today, something's off, they're slurring their speech, they're forgetful, they're staggering. I'm not 100%, but they're presenting as potentially unfit for duty, and it could be because of substances. Maybe they were drinking. I'm not entirely sure. This is an important piece of a reasonable cause intervention investigation is you do not have to be 100% sure that this person is impaired by a substance. It's definitely drugs, it's definitely alcohol, it's definitely medication. You don't have to be 100% sure. You just have to have reasonable cause, reasonable grounds, reasonable suspicion that they may be. And you're going to make sure that you document this. There's lots of other things that go into this, which we'll unpack as we go, but you just need to have reasonable cause that they're presenting as not fit for duty to take action. So it matters because you have an obligation and a responsibility to keep your workplace safe. So you have a responsibility to protect the employee in question. So this specific employee is presenting as maybe unfit because of substance use. You have an obligation as a manager, a supervisor, a company owner to protect that worker from themselves. You have an obligation to protect that worker, other people from actions that they might take. If they're not fit for duty, they could potentially put other people in harm's way. So you have an obligation to protect your whole team, as well as the public. If you're driving vehicles that are on public roads, if you have an impaired worker behind the wheel, that puts the public at risk. So you're protecting the public and the environment. So if there is a spill of oil spill, gas spill that can harm the environment. So there's a responsibility to protect the environment as well. So it also matters because a lot of you that are here, are likely safety managers, you work in health and safety, you work in HR, or you're a supervisor in your company. So therefore, part of your obligation and duties are to uphold company policies, which your drug and alcohol policy and fit for duty policy is one of them. So that's another thing that we do and we support companies with is understanding your policy, rewriting it, answering questions around it to help make sure that you're comfortable with it and confident with your policy, to make sure that it's adhering to Canadian model for providing a safe workplace, human rights, and other and OHS as well. So this matters because it's helping you comply with that policy, site policies. But so by site policies, I mean if your company is working on another site, then you're also you probably, as part of your contract and part of your terms, you've likely agreed to abide by their drug and alcohol policies and safety policies as well. It's also important to comply with occupational health and safety. And one note on that, and I think this is an important note to give you and your team of managers confidence in taking action when there's reported or suspected substance use impairment, is you have a legal obligation to maintain a safe workplace. And if you see unsafe work practices and you do nothing, you could legally be held liable. So it's a legal responsibility to take action. I think that can really be helpful in some of these situations because these are difficult situations to go and pull somebody aside or somebody that you've potentially worked with for a long time who may be showing up to work hungover or intoxicated, and pulling that person into your office and having a conversation about it and addressing that. These are really uncomfortable situations. These are conversations we'd likely rather not have, but we get to have them. It's part of being a leader. It's part of being a manager. We get to have difficult conversations like this. So in those moments, it can be helpful to remember, I have a legal obligation to protect this person from themselves, to protect everybody else, to protect the public, the environment. I have to do this. I get to do this. And to comply with Canadian human rights. So human rights also says, there's a dignity of the person. There's a way to go about this in a way that protects the dignity of the person and everybody else at the workplace. And by addressing substance use in the workplace, it keeps your staff and your company working. So an example of that, a practical one is, very real one that's come to my knowledge quite recently this is a great example of a company who's got a contract on another site to perform work for them. And this company chose not to complete drug and alcohol testing for whatever reason. We hear many companies choosing not to. Different reasons are, the cost of it. It's hard to Another reason we hear is it's hard to get workers. So the more testing we do, now that marijuana is legal, we can't find people to pass a marijuana test. So these can be, reasons that we hear for people to say we're not going to do testing anymore. And I'm not sure exactly what the reasons were for this company, but to my knowledge, they weren't doing testing. There was an incident at the company or on site, on the contractor site. A post-incident test was requested. The employee failed the test, and the company lost the contract, lost the work, and has since been had to let workers go. They've lost a lot of work. So this doesn't just impact the company, it impacts the employees, it impacts a lot of families. So by doing this, by taking action, you're protecting them from themselves, but you're actually protecting everyone as well in the workplace. So next question for us is, when do we intervene? When is it appropriate to intervene? We intervene on suspected or reported substance use or impairment or someone not being fit for duty when they pose a risk to themselves or others, when they're non-compliant with the drug and alcohol policy, So you know your policy, you know the reasons, what the conditions when they're compliant, when they're not. So if there's any one of them where they're not, you get to pull them aside immediately and take action and to have a conversation with them. When they're exhibiting signs of impairment, I'm going to share some of those with you on the screen shortly. Or when they self-disclose. So self-disclose means an employee comes to you and says, I have a problem with drinking. I have a problem with drug use, with pills, whatever it might be. I have a problem with drug use and I want some help. So that's, of course, you're going to intervene in that situation and you're going to get them assessed, get them the proper help, remove them from duty pending a substance abuse professional assessment and return to work program. That too, we're going to get to shortly. So here's some things to think about. What does substance use look like? So first off, we're going to talk about what does it physically look like? If you're physically, standing in front of somebody who an employee has come to you and says, John, I think one of your workers is there's something off with this person today. I'm pretty sure he's either high or drunk. Something's going on. You need to go and have a conversation with this guy. So if I go and pull this worker aside, have a conversation, these are some of the things that I'm looking for. So I'm going to look at their appearance, hair, eyes, nose, arms, hands, gait. So are they staggering when they walk? Are their eyes bloodshot? Behavior, compare it against their normal behavior. So you know your team, you know what their regular behavior is. If they're usually really outgoing and lately they've been really quiet and reserved, or if the opposite, they're usually quiet and reserved and wow, they're really talkative and loud today and or really angry, they're different. Something's different about them. So you're going to be looking for differences in their behavior. Speech, is it slurred? Odor, are you smelling alcohol? Fatigue. Um, why this one can matter is sometimes when people are using drugs, they can be up late, they could be up for days, show up to work tired. Basic motor skills, are you seeing deficiencies in that? Are there signs of drug and alcohol use? You may be seeing track marks, so needle marks, or you might be seeing paraphernalia. So if there is another question that we can get, situations that have happened at workplaces are we found a flask, we found a baggie with white powder in it, we found a bag with weed in it. Can we test the crew? Can we test the person? And if you can pinpoint that paraphernalia to a specific person and say it's clearly, part of it was in their locker, it was in their truck, it was in their bag, their lunch bag, it fell out of their bag, something like that, where you can verify it came from that person, then yes, that in itself is grounds for to request a reasonable cause drug and alcohol test. If it's found in a common area, a staff room, then you maybe can't pinpoint it to a person. Some companies have said, well, we're going to request a reasonable cause drug and alcohol test on every worker that has been in that staff room today, or since we can verify that thing wasn't there. So there's some physical things to look at. Here's some psychosocial considerations when considering, is this a reasonable cause situation, and can we request a drug and alcohol test of this worker? So if there's family issues, so divorce, separation, loss or death, new baby, um, new baby could be up all night. That could be why a person is tired. So of course, you're not going to take one of these situations on their own and request a test. These are just things, we're going to put a few of these things together as part of the investigation. We're going to these are things to pay attention to. So mood fluctuations, so highs and lows. Typically, they're a mellow person, and suddenly there's a change in them. Loads of energy. Inappropriate verbal or emotional response. You make a request of them, and the response is instant anger, which didn't quite match up with the request. Isolation from colleagues, lying, more excuses for their behavior. So there can also be performance indicators, things with their performance that are important to pay attention to. Are they absent from work a lot? Take a lot of sick days? Do they arrive late, leave early, take a lot of breaks? Are they being more forgetful, making more errors in judgment? Is their performance deteriorating? So some things to keep in mind for you and your management team. So another question for us is, do I have the right to intervene? So this speaks to the uncomfortability of intervening and wanting to be sure, is this appropriate for me? I don't want to step too far. I don't want to make a request and then this comes back on me where it wasn't appropriate for me as the manager to request that. I took that was a step too far. So do I have a right? So quick answer is yes, you have a right to intervene if you have reason to believe this person is presenting or poses a safety risk to themselves, others, the environment, the company reputation. There's other things that can factor in. So if they're presenting with physical signs, bloodshot eyes, staggering, um, forgetful, can't focus, slurring speech, obvious signs of impairment, absolutely, yes, you have a right to intervene. Not only a right, but you have a legal obligation, as I mentioned before. Occupational health and safety makes it a legal obligation to intervene when you see unsafe work practices. If you do see unsafe work practices and do nothing, you could be held liable. You as a manager, you as a supervisor, there could be action taken against you if you see something and do nothing. So Canadian model for providing a safe workplace also supports this. Most of us are familiar with this Canadian model. It's considered best practice for drug and alcohol testing in Canada. Side note, there's apparently a new version of this coming out in early 2026. So something we'll of course inform you of that when it comes out. Make sure you get the link to download the new one. But that's something to watch out for. Canadian model for providing a safe workplace talks about and supports reasonable cause drug testing and your policy, your company drug and alcohol policy likely references and is modeled around the Canadian model for providing a safe workplace. And it also talks about the importance of supervisor reasonable cause training. So the Canadian model says all workers in the safety sensitive, all managers in the safety sensitive industry should get training in supervisor reasonable cause in how to recognize signs of impairment and how to appropriately intervene. So it also, last point here is, do I have a right to intervene? Yes. And again, it's a way for you to offer support to your employees who may struggle with substance use. This is a beautiful opportunity for you as a manager and as a company to recognize an issue in one of your workers' life and to offer some support, to offer some help, and to say, I've been noticing some changes in you. Do you struggle with substance use? If so, we want to offer you some support. We've got counseling. We want to get you assessed. We're going to come up with a substance abuse. We're going to come up with a return to duty agreement for you. We're going to get you assessed and come up with a treatment plan. We want to support you in this. So it doesn't just support them, it also supports their entire family. So some important things to consider on how to appropriately intervene. So one of the first things is you are going to take immediate action. If you get a report that somebody on site is unfit because of potential substance use, you're immediately going to drop what you're doing and you are going to take action on that. You're going to go and find that person. You're going to meet with them in a private area. It's always advised to have two supervisors present for two reasons. I want to make sure that I'm seeing clearly and that somebody else can verify what I'm seeing. I might think and believe this person is under the influence potentially right now, or maybe they're just hungover. Some of these areas are gray and we're not entirely sure how to intervene. We want somebody else to support us in that. So get support for that reason so that we can be sure that we're dealing with this appropriately. And if anything ever comes back where an employee would, come and take action against you or against the company because of this situation, it's good to have another supervisor supporting you in this decision. So you're going to remove them from duty, go to a private area, explain to the employee exactly what was observed. Here's what my concern is. My concern is you came in an hour late. You smelled like alcohol. You were staggering, slurring your speech. I had reports from a number of people saying they were concerned about you. That's what we're here to talk about right now. So, and you know that we have a drug and alcohol policy here at our company. And because of that, because I'm a manager here, I'm a safety manager, Part of my duty is to enforce that policy. So that's what we're here to talk about and give them an opportunity to respond. And it's also an opportunity for you to have a conversation with them and to get clear on what are we dealing with here and what are our next steps going to be. So you want them to respond. What works in these situations is to speak calmly, to stick to the facts. Sometimes in these conversations, it can get sidetracked. It can go, employee might want to bring up something else. Well, it's not, no, I smell like alcohol because of, I just didn't sleep well last night because of, you might hear stories. Some of them might be true, some might not. And so in these situations, a lot of times we're wading through what's the truth. And again, that's why you want somebody else to be with you and back you up. So you're going to stick to the facts. We're not talking about, they might bring up, why are you picking on me? We all know that there was an issue with so-and-so last week and you guys didn't do anything. Different things might come up in these moments. We're going to stick to the facts, here's what we're talking about. We're talking about what happened today with you. That's it. Right now, if it's appropriate to talk about those other things, we'll talk about them later. But right now, we're talking about this situation at hand. You're going to repeat your observations. You're going to emphasize the company policy. And why that one's important is you want it to be clear that I'm pulling you aside to talk to you about this because as a manager here at this company, part of my job is to enforce the policy. That's why we're talking about this. That's why I'm requesting a reasonable cause drug and alcohol test, if that's the decision that the two of you supervisors make at the end of this. We're requesting this because our policy states if we have reason to believe someone's not fit for duty because of substance use, this is what we do is we immediately take you down to a clinic and get you tested. We complete a drug and alcohol test. So it's not me coming up with this. It's me just carrying out the policy. So you want to keep referring to company policy. You're going to use non-threatening questions. You're going to keep conversation on the current situation. Covered that one. And you're going to document. So anything that is said by the worker, everything's going to be documented. What you said, what you conveyed, what they were conveyed back, what the decision is that you make at the end of that conversation. You want to make sure everything is documented. So the 5 steps for reasonable cause investigation is something that we dive a lot deeper into in the supervisor reasonable cause training course that we offer. And these 5 steps they're nice and simple and super clear, a way to walk through these situations. So a couple of them we've talked about already. So I'm going to walk through each of them. So observe, confirm, document, confront, and then remove from duty. So when there's somebody in question of not being fit for duty, the first thing we're going to do is we're going to pull them aside and I'm going to observe it firsthand myself. I'm going to see firsthand myself. I'm going to observe. Confirm talks about having somebody else confirm it, another supervisor, a second person confirm it with you. So I'm going to observe it myself. I'm going to get somebody else to confirm. If we're both in agreement, yes, I believe this worker is unfit for duty because of substance use. I think we've met the threshold of we've met the requirements of a reasonable cause test. We're both in agreement. We're going to request that they complete a reasonable cause test. We're going to confirm that. The third is document. So we're going to document the request. We're going to document all the details. At 8 o'clock, worker showed up to work, which was an hour late. At 8:30, I got reports from 2 of their coworkers that he smelled like alcohol. They were concerned about him. At 8:40, I met with a worker in the boardroom. At 8, and then here's what I saw at 8:50. So you're going to document everything that goes along with that. And you want to supervise a reasonable cause report form. You want a place to document all of that. And then confront. So confront is after you've documented, we've confirmed, we both agreed, me and the other supervisor, we both agree that we're going to request a test. At this point, we would phone assure and say, we've got a reasonable cause situation. We're going to bring the worker down probably in the next hour or 2 hours. You give us a heads up. These appointments, whenever you call us in these situations, you always get bumped straight to the front of the line. When you walk in the door, you get bumped to the front of the line because we know that breathalyzer breath sample gets to be taken immediately. The urine sample or oral fluid sample gets to be taken immediately to get the most accurate result. So you've documented, you've made the decision for to test. You phoned us, you booked the test. We were notified, or we booked you in Fort McMurray. We booked you in wherever this incident happens. So then you go back, confront. You tell them what confront is all about. Is you meet with them and you tell them, here's what's going to happen. We have reason to believe that you're showing signs of being impaired from substance use, and you're going to tell them the details. Because of that, you're removed from duty pending an investigation. The first part of that investigation is we are requesting that you complete a drug and alcohol reasonable cause test. Do you agree to take the test? So you're going to ask them. Because they, of course, have a right to refuse. Human rights says, they can refuse. But if they refuse the test, now they're in violation of the company drug and alcohol policy. So if the company representative requests the test based on reasonable cause and they refuse, which they have the right to, they're now choosing to violate the company drug and alcohol policy, and you would take action based on that, based of them not being compliant. So they don't have to do the test, but they're essentially choosing not to return to a safety sensitive position. So if they do agree, now you continue to remove them from duty and you would carry out with testing. So the next thing to think about, you've removed them from duty, you're doing an investigation, you've done the test, and the test result comes back positive. The next step is, because it's an important one, okay, they've tested positive, they've self-disclosed, I have a substance use problem, or I've got a drinking problem. What do we do with them now? What we do with them next is you want them to complete a substance abuse professional assessment, or a SAP assessment. Some of you might know it as that. Substance abuse professional assessment is where you'd phone us and say this, sure, we need an employee booked in for a SAP assessment. We would schedule that for you with one of our SAPs, these are, I think 99% of them now are done virtually, where an employee, you'd give us the contact info for the employee. We'd set it up for you. They would do it virtually, where it's a couple of hour assessment where they're doing an in-depth examination of that worker's substance use history, drugs used, medications used, how long they've used it for, family history. They're doing an in-depth assessment and they're making a diagnosis to determine, does this employee struggle, or do they abuse drugs, or do they have an addiction? So, because we deal with abuse and addiction very differently. So human rights says we have a duty to accommodate illness in Canada. Addiction is considered a diagnosable illness. So we have a duty to accommodate illness or medical conditions in Canada. We don't have to accommodate abuse. So the first thing that we want to do is, what are we dealing with? How do we appropriately accommodate this person? So the SAP, the professional, the SAP is going to make a determination. Do they have mild, moderate, or severe substance use disorder? Or do they have no substance use disorder? Then based on their assessment, they're going to then create a treatment plan. They're going to provide that, 1 or 2 page document that says, based on my assessment of this employee, here's my treatment plan, which we then, at Assure, we turn that into a draft return to duty agreement that we would provide to you, and that you could, you take that and you create a return to duty agreement for that employee. So if the employee wants to come back to work, they agree to abide by the terms of this return to duty agreement. So some examples of what it can say in there is, it might say, this person needs to go to a week of detox, 4 weeks of inpatient addiction treatment. Or it might say, it's not that severe. They don't need to go to inpatient addiction treatment. They need to go to some outpatient counseling. They need to go to 1 session a week, 1 session every 2 weeks for 6 months. These are just some examples. It's all individualized based on the assessment. So it might say counseling, follow-up testing. Quite often it involves follow-up testing, which is a really helpful way to help somebody stay to maintain sobriety and to maintain recovery, is to know over the next 12 months, I may be drawn 6 times for a follow-up drug test. I don't know when that's going to happen, but part of my agreement is I've agreed to be subject to 6 unannounced drug and alcohol tests over the next 12 months. So we create that draft return to duty agreement. for you, provide that to you. You would then sit down with the employee and they would review it. If they agree to the terms, they would sign it, and that becomes the agreement. If they want to return to work and go to the safety sensitive position, that becomes the term. This is the agreement. And as long as they keep up the agreement and their end of things and the agreement, going to counseling, follow-up testing. There might be some pre-return to duty recommendations that are made, like they need to attend cannabis impairment or cannabis safety education session is something I've seen as recommended um, prior to return to duty. So there may be some things they need to check off before they go back to work. You work with us. That's one thing that we support you with at Assure is we work closely with you or whoever the manager is of that employee to help you in help this employee maintain compliance with the return to duty agreement. So that's the important next step after a policy violation, which could be a failed drug test or self-disclosure, either one. The next thing you want to do is get a substance abuse professional assessment so that you know how do we appropriately deal with this employee and how do we return them back to work. So a lot of what we've talked about today is a short form of our supervisory reasonable cause training course. And what this is, supervisory reasonable cause training course, this is a course that we offer virtually. So via Zoom, just like we're doing right now, via Zoom, it's a 3-hour course to train you and your entire team, your entire management team on how do we appropriately identify and manage substance use or substance impairment in the workplace. So how do we identify what is reasonable cause? When do we have the right to test? When do we not? How do we handle these difficult situations that can arise? So something that we dive deeper into is quite often we have these conversations. You pull someone into your office and say, here's the behavior that I'm seeing. Based on that, we're requesting a test. Sometimes these situations can get volatile. They can get angry. They can get a little blurry and gray. We don't, they can bring up old situations. They can bring up things from the past. Um, they can evoke sympathy. They might get tearful. What if they admit to begin with, you're right. Yeah, I did some coke last night. I'm going to fail the test. In that situation, if somebody discloses or admits that, would you still test? Would you not test? So these are some of the things that we dive deeper into in this training course. So the next offering of it is January 14th. It's a 3-hour course, 8:30 in the morning to 11:30 Mountain Standard Time. To register for that, you can just email carrie@assuretesting.com, reply to the email that you got the link to today's webinar for. It's likely Carrie's email as well. So it's one of the best ways that you can get your team trained and on the same page to know that we're handling this in the same way. We're all on the same page in how we address impairment in the workplace. And one of the most important pieces that we give in that course is a supervisor reasonable cause report form. A form where it helps you identify the signs of substance use to look for and a place to document it. It's all spelled out for you. And we give you a bit of a cheat sheet on those 5 steps of reasonable cause investigation so that when a situation arises, it's just pull out this cheat sheet, walk through the 5 steps. We make it really simple for you. So if you want to get your team trained on that, we'd love to see you on January 14th. Email Carrie. And if you've got any questions about any of this, or if you've got a specific situation that maybe you're dealing with in your workplace, and maybe you don't want to ask it here on the webinar, I get it. Feel free to give me a call. Shoot me an email, john@assuretesting.com. I'd love to walk you through it. If you've got questions about your policy and enforcing it, rewriting it, whatever that might be, we'd love to support you in enforcing your drug and alcohol policy. So thank you so much for being here with us today, and look forward to most of your names I know, and nice to see your names on here. We've been supporting you for some time, so look forward to continuing to support you, and thanks so much for being here with us today. See you on the next one.